Everybody knows in America that obesity is a major issue and it's not going away. And to lose weight can even be a bigger problem. And nobody knows that more than this young man. This is Dr. Robert Michelson. Nice to have you on board this morning.
Thanks, Gard. Glad to be here.
Of course, you're with the Northwest Weight Loss Surgery.
Yes.
And you guys have had incredible success. But first, let's talk about a little bit about just this obesity problem we're having in the U.S.
This is a huge problem. In fact, it's one of the leading public health problems the United States is currently facing. A full 2/3 of the United States population is either overweight or obese, and the problem just getting bigger and bigger every year. People are struggling with their weight. They've struggled for decades, on average struggling for 17 years before they come here.
And we're going to be giving away one of these, and this is a LapBand that you guys do. That's part of your procedure here.
Correct.
And how does the whole thing work?
Well, the LapBand is essentially, in its simplest terms, a circular balloon that is placed around the top part of the stomach. And that balloon is adjustable through this little port so that we're able to blow up that balloon or deflate that balloon depending on an individual patient's circumstances. So when we inflate the balloon, we're able to delay the passage of that food through the band, and what it does is it suppresses appetite. So the idea here is to allow complete appetite suppression so that patients are able to choose healthier foods and not be plagued by hunger and appetite that sabotages diets.
And it works, right?
It works tremendously well.
And it's almost unbelievable. These are two of your patients here. It's Heather and Robin, and I'm looking at these pictures here, and I'm not believing that this is you. I mean, I think it goes like this, right? These are you and you?
Yes.
So how much weight have you lost?
I've lost 265 pounds.
265.
165.
So we're talking like 430 pounds between the two, you and your
Yes.
sisters. What has that been like for your life?
It's been an amazing change, a good change, positive. We're a lot more active and have more fun in our life, and we get to do the things we used to do all the time.
It's given us a big boost in our self-esteem. I hated going out in public and eating out at restaurants, just the way people look at you when you're overweight, just the look of disgust. I mean, they don't even have to call you a name or use any words. It's just the look in their eye when they look at you when you're overweight. It was absolutely horrible.
Were you guys embarrassed how heavy you were?
Yes. I was to the point where my doctor had told me in 6 months I'd probably be in a wheelchair because I wouldn't be able to walk anymore. That's how heavy I was. And that was the point where I decided that I had to do something.
And then when did you start losing weight?
We immediately started losing weight before our surgery. We took on the things that we weren't supposed to have, and we started immediately, so we would be used to that by the time we had surgery.
So you not only get the band, but you also have to start exercising now. You got to change your diet. I mean, it's like a three-pronged deal, right?
Oh, yes.
You have to relearn everything, relearn how to eat, and it's just a whole process that you have to go through.
Can you guys believe that? What have you done with that yellow shirt?
I still have it.
You do?
It's the one I've kept.
It's a good reminder, isn't it?
Oh, yeah.
Dr. Michelson, you're doing some incredible stuff here.
Thanks, Gard.
And before we go, how many surgeries have you done?
We've done over 4,000 surgeries at Northwest Weight Loss Surgery.
And that equates to how much fat?
That equates to about 100 tons of fat.
Gosh, so if people want to start losing weight, how can they get involved in this contest?
Well, they can go to chirotv.com and tell us a little bit about themselves, what struggles they've had with their weight, why they want to get a LapBand, and also attend a free seminar. And we'll be able to provide them the information they need to determine whether this is the right choice for them.